not really been streamlined, to build up that strong base of evidence. This is really the gap. It's like you find all these dots and we really need to, link them together before we get the bigger picture. I think that is the challenge that we have in front of us. And integrative approaches in Ayurveda and yoga and heart disease, also there are some preliminary thoughts about this, but nothing really substantial that brings Ayurveda, yoga and modern medicine together. I think that's really very important. So I just want to sum up this. It's more like what is it that we need to do to really bring Ayurveda into the mainstream in terms of cardiology, is that if you look at the triangle of evidence, textual sources, traditions of practice, and scientific diseases, scientific research, we find that Ayurveda seems to show strong potential for coronary artery disease, hypertension, valvular heart disease, congestive heart failure, and so on. But the challenge is proper translation and interpretation of texts. There's lack of rigorous clinical documentation, too much of simplification of the Ayurvedic treatment and research settings, and want of rigor in clinical trials, that at this stage what we have is poor quality of evidence. So in complex conditions of cardiovascular disease, I think an approach that integrates yoga and biomedicine along with Ayurveda is what is needed. And I think that that is a roadmap for the future. We have these dots which we need to link together. We need to generate, high quality evidence from Ayurveda, and then Ayurveda could serve as a link that can bring Western medicine and yoga together to offer a complete and multi-modal intervention for cardiovascular disease. I think this is the way that we should go forward. I couldn't generate evidence which was not there, so I tried my best to present and make sense of what is available, and this is from a researcher's viewpoint, not essentially from a clinician's viewpoint. Thank you for the attention and the opportunity to share my thoughts.
For a brilliant presentation. That was extremely enlightening. Do you want me to make the presentation?
So our chairperson, Dr. Alex Hankey, will hand over the token of love to Dr. Ram Manohar. Dr. Alex Hankey will introduce the next speaker, Dr. Geeta Krishnan.
It's a great pleasure for me to introduce my dear friend Dr. Geeta Krishnan, who is one of the real stalwarts in Ayurveda community in India, has represented Ayurveda in many international events abroad at the request of the Ministry of Health, the Ministry of Ayush in Delhi. He is currently the head of the Integrative Medicine Department in Medicity Hospital, Medanta, Gurgaon in Haryana, just outside New Delhi. He's the head of the Integrative Medicine program there. He has propounded the axial something or other. Sorry, the printing of this paper was simply terrible. An integration which favors translational medicine and supports judicious need-based integration of medical systems. Note the careful wording of it. Judicious need-based integration of medical systems. Anyone who is judicious knows that because modern medicine kills so many patients, as Professor B.M. Hegde tells us, that any judicious person recognizes the need for the integration of systems. Among these integrated interventions, minimally invasive thoracic surgery, chronic pelvic pain syndrome and dengue care are implemented as clinical protocols at Medanta. Something it's well known to you that tradition can cure dengue fever with a simple remedy that modern medicine still neglects, absolutely disgracefully. Collaborative research is one of the strongest forces of Dr. Gita Krishnan. At present, his appointment has collaborative clinical research with CCRAS, S-VYASA University, Foundation for Medical Research, and the Ruhr University. He also leads 2 herbal drug development programs, solid tumor and thrombocytopenia, working in collaboration with IIM, part of CSIR. Dr. Gita Krishnan.
It's okay? Thanks. Thank you, Dr. Alex Hankey, for this great introduction. Of course, I should say it was a wonderful introduction for me. As I should like to, or I would like to say that, after speaking after Dr. Manchanda and as well as Dr. Ram Manohar is like trying to sell, small toffee to somebody who had just had a good feast. So, but I will try my level best. I'm basically not a researcher alone. I'm a clinician basically, but my clinical work is entirely dependent upon research. And I work in one of the largest hospitals in the country, in the private sector and the public sector together. We have more than 25 super specialities in the hospital, with around 1,600 beds, which includes around 200, intensive care unit patients. I usually see around 30 to 40 patients a daily basis, and I have around 10 to 20 IPD all the day, basically. But the fact is that none of my IPD patients or inpatients are my own patients. They are all referred patients, and all my 70% of my patients are referred. Now, just wanted to give you an idea about from where I am talking, because my discussions are not based on a clinical trial program, but basically based on what I have observed in the past 5 years, and gone through and went back with our understanding about what happens to a patient when we administer a therapy to a patient. And it has been in the integrative mode. We have a very clear mandate. We are creating an integrative medical program for different areas of clinical practice in the country. And we think that our aim is that this is my chairman, and there's a photo of my hospital. The aim of integration is to offer the best possible cure, care and management of the patient. This is what we believe in. So we don't believe in any systems. We don't believe in any of the medical systems as such. We think that creating silos will only keep people away from medical, pluralism and of course effective medical management. So we try to bring all these things together. It's an experiment we had been trying for the past 6 years and had found some benefits. There is a process of integration at Medanda. So if I it is there? No, it's not there. Right. So this is a process of integration. There I have a clinical practice where I practice only Ayurveda and yoga. Patients come to me, I look at them, and then I refer. I understand what their problem is, and I administer the treatment as per the requirement from yoga or Ayurveda. That is simple. Then there it starts only. Then I start collecting evidence of what I have done. I follow up the patient, and over a period of time I come back with the evidence saying that it is beneficial or it is not beneficial. If it is beneficial, then I identify areas in the modern medical system which is not effectively providing medical care to the patient. Everything that I am working on might not be necessary to be integrated. That's the first thing. So I don't work only for integration. I work for Ayurveda. I find out evidences, and then I go back to the system where I'm working, and I identify areas which is not beneficially intervened by modern medical practice. And then I go and tell these doctors that, please see, I think that there is something which you are lacking, and I am able to help you. Then we start. Then we start working together. We see few patients, maybe around 20-30 patients. We actually go through the patient's benefits over a period of time. Sometimes depending upon the disease. For example, dengue we look at only for 7 days, whereas in a cardiac patient we might follow up the patient for 6 months. Stroke care we follow for 1 year and more. Oncology, of course, we go on managing palliative care. We go on managing for the past 6 years. We have patients whom we have been following. So it's a wide variety. But then we identify areas which we can work together. And when there is addition, there is a benefit. Then we go and bring that together and make it into a protocol. There's a picture which we have published in the JAME journal. Okay, now let us come back to our program. The global disease burden in 2015, out of which 52% were non-communicable diseases. Out of these non-communicable diseases, 37%, it's a huge number, were cardiovascular diseases. And if you look at the burden of cardiovascular diseases, you can remove the stroke part out, because we are not considering that in this particular issue. We are looking at coronary heart disease, and then we are also looking at inflammatory heart disease and some forms of rheumatic heart disease and other forms of heart diseases. I am not discussing about hypertension and benefits of hypertension because I was sure that many people will be talking about it. So how do we look at the whole process? We think that there is a unified philosophy of yoga and Ayurveda which we can identify and we try to implement. There is one difference between the modern science and traditional sciences, or rather especially the Asian sciences. In modern science, there are particles, and they come together. There is energy which forms into matter, and then matter forms into particle, and then these particles interact with each other, and then all of us are formed. But the same process as if we discuss in the Prakriti and Purusha, everything, like how the 24 tattvas are forming together and coming together to create the entire universe. It is exactly the same, but the difference is that in Asian sciences or the Oriental sciences, or especially in Indian philosophy, it is not an accident, whereas in Western philosophy it is an accident. The formation of this universe is an accident in Western philosophy or Western understanding of the world, whereas for us it is a deliberate act, and it is part of consciousness. So this consciousness is conveyed to the it gets information or experience through the mind, the medium of the mind, and this mind consciousness combination actually control the entire 5 elements. And this combination, when it interacts with each other in a particular manner, forms what we call as life. The structure which with the assimilated 5 elements take is called the body. And Ayurveda and yoga are excellent tools which can synchronize the conscious mind-body triad to align itself with the environment so that the dance of elements forming life continues unabated, as natural as its Prakriti. So this is what we look at when we try to understand a patient from the point of view of yoga. You have body, then you have body and mind, then you have mind and consciousness. I had tried to look at it from the point of the cardiac disorders, from the point of view of body and mind and consciousness. In body, I would say rheumatic heart disease. Rheumatic heart disease. I'm not talking about rheumatism as such, but I'm talking about rheumatic heart disease, which over a period of time becomes a body-based disease because it is a valvular disease. And then we have left ventricular aneurysms, which happens after a myocardial infarction. So that is definitely a body-based program, like a disease which happens as a complication of the previous disease. Then we have hypertension. It is also body and mind, and congestive heart failure. In heart disease, it is very difficult because to actually distinguish between a mind-body disease and a mind-consciousness disease and a body-based disease. But I would specifically say I choose hypertension for body and mind as well as of mind and body and mind as well as for mind and consciousness, because just to tell you that depending upon what kind of hypertension that a person has, what is the origin of the hypertension, we will be able to say whether to classify that patient under body and mind or under mind and consciousness. Then we have, in mind and consciousness alone, we have hypertrophic obstructive cardiomyopathy. It's a very like it's kind of a genetic disorder, but doesn't come up in everyone. It's a epigenetic change which causes this particular very like difficult to treat and often leading to death very soon kind of a disease. So that is part of yoga. If you look at dosha base of cardiac functions, you cannot look at cardiac disease as a heart based disease. As Dr. Ram Manohar had said, it is not a heart-based disease. When you talk about cardiac diseases, you cannot only picture the heart. We have to look at the heart, the brain, the lungs, the blood vessels, the stomach, the liver, all these things which all form part of the function of heart, because we don't look at heart, the structure, but we look at the heart, the function. And when we look at the heart, the function, then all these have to come into the picture. If these don't come into the picture, and if you are only looking at the heart, then you cannot treat a heart patient. That because of our strong inclination to prove ourselves in the modern medical community, we always try to focus on the heart, and we forget that 90% of the heart is actually functions related to other organs. It is not the heart itself, it is something else, somewhere else, which causes a trigger for the heart disease. So if you look at the dosha base of a cardiac disease or a cardiac function, you can find that in Vada, all the 5 Vadas are involved in it. You might all know that Vyana is staying in the heart. Like when we learn Vyana, we learn that Vyano hridisthidaha, Krishna dehajari mahajavaha, getya avekshebano ksheba, nimesha unmesha nidigaha. When we read it in the textbook, we are told that it is for opening of the eye and closing of the eye. But just think about the valves. It opens and closes, and it stays in the heart. So it actually should be thought about as something when a valvular disease is happening, or you have a mitral valve regurgitation, you should always think about Vyana Vayu. And that is how you should try to understand from an Ayurvedic point of view how a cardiac disease or a cardiac function is happening. You should look at Pitta, you have Sadhaka, Pajaka and Ranjaka Pitta. I don't have to explain, or I don't think that I'm going to explain about it. And of course Avalambaga, Kapha, which is also a major part in the dosha base of cardiac function. I would like to just go into the next phase. Before that, I would like to speak about Ama and Dhadupaka and Dosha, which is very important in terms of understanding a heart disease from the point of view of a yoga person or from an Ayurvedic person. Ama is nothing other than a metaphor for inflammation and metabolic dysfunction. You should understand that. Ama is nothing other than it's not a chemical or anything. It is a functional abnormality somewhere in the body. It could be caused by a chemical, it could be when I say it could be caused by a molecule which is not actually there. It could be a molecule which cannot be removed from the body. It could be a micronutrient, it could be a micrometabolite. There could be many reasons for that. But Ama is to be understood as a metaphor for inflammation. And as the entire world knows right now that 90% of the cardiac diseases, which we call as cardiovascular diseases, are basically because of inflammation. It starts in inflammation. Every single cardiac disease starts in some kind of inflammation. So Ama denotes early stages of any pathology. If you understand generally Ama, there is no disease without an Ama stage in its progression. Ama is the initial phase of metabolic dysfunction. Symptoms of Ama are inflammatory changes, and secondary changes to inflammation. So what happens in metabolic changes triggered by Ama? We have Srodorada, which is blockage of channels, impaired functions, unusual accumulation of materials, slowdown or halting of metabolic processes, loss of vitality, reduced catabolic processes, excess secretion, accumulation of waste, altered affinities, and exhausted energy or substance of metabolism. I am just translating as you can understand from Srodoroda Belapramsha, Gaurava Anila Mudada, Alasya Abakti, Nishtiva, Malasanga, Aruji Klama. And this is exactly told as told in Ashtanga Hridaya. So you can see that Ama and Ama and this has a very common factor. Inflammation has a very common lineage, and we will be able to if we are able to manage Ama, we should be able to manage inflammation, and therefore we should be able to manage a lot of cardiac disorders. So how do we integrate Ayurveda and yoga in our approaches? This is what we look at. We look at whether the disease is from consciousness, from mind, or from the body, or is it a combination of any of these three. And then we look at what is the prakriti of the patient. We look at the dhatu of where the problem is, and then we look at agni of the patient, dosha which has been vitiated, srodhas, belam, and prana. I can go into more and more details and tell you how this is being done, but I think this is generally how we look at it. I would like to take you through 3 different kinds of case studies which I have over here. One is on reversal of cardiosclerosis. This data is from a close friend of mine, Dr. Naushad. He's a Ayurvedic doctor who had done his MBBS and then thereafter done his MS and MCH in cardiothoracic surgery. He practices in Russia, and he and I and Dr. Ram and all, we worked together, but I and Naushad had been working on a particular group of patients with cardiac diseases, and this is one of his patients' disease description. This is quite simple: benefits of panchakarma and reversal of cardiosclerosis. If you look at the picture on the left-hand side, this is a thallium scan. Like when you look at when you inject a picture and then you look at what is the perforation of blood vessels in the heart wall. If you look at that, the black dots you see on the left side are basically dead cells. They don't work anymore because there is no blood supply over there. This is a patient's PET scan immediately, means about 2 weeks after his first cardiac arrest. And then he undertook Snehapana. The only treatment that was given to him was a very good Snehapana and Virechana, which is one of the therapies in Ayurveda. And then we were actually writing a paper, and we wanted to make a presentation to the funding agency. So we asked the patient to do another PET scan, and this is the right side is our PET scan, which is after 2 years. This is unbelievable kind of a change in a thallium scan. You cannot see this because this has never been seen before unless and until you have revascularized chest, or even let us say about 10% of the patients who gets stem cell transplant, they get this kind of a result, because not more than 10% of the patients benefit from stem cell transplant. But if in those 10% of people this kind of benefits can be seen, this is unbelievable kind of a change. So I requested Dr. Naushad to share me the photographs, and he had kindly sent it to me for your information. Now this is my work. We had benefits in cardiac function is what I had looked at. This was not a study which was done. This is my part of my internal assessment of what we are benefiting in. And we work with several doctors, especially in cardiology. We have 13 patients. I'm giving you the reference of 13 patients. We had selected patients who had less than 35% of their heart, left ventricular function in the first visit, and we had a 6 months follow-up. These were the criteria which I had selected with this. I had 5 doctors who had worked with me in this. So these were the interventions we had. We had drug, we had procedure, we had yoga, and we had diet. So I'll go through them one by one. Drug, these were the medicines which we had used: Vasha Guluchiyadi Kashayam, Brihat Nayopayam Kashayam. I'm not going to go through all of them. This is a decoction which we had given to the patient. This is the internal medicines. These are the internal medicines we had given to the patient when all these patients had got these internal medicines. These were the external therapies we had given to the patient during this period. And you should understand that Uro Tarpan is exactly like Uro Vasti. We call it Tarpan because that is a function of Uro Vasti. But we do it in a slightly different manner. We do not make large wells, we make very shallow wells, and we change the timing in which we do the Uro Tarpan. So that is the only change which we had done in this. Then we do Snehavasti. We have used the drugs used are been mentioned: Dhanudiram Thailam, Kotam Chikadu Churnam, and Dhanudiram Medukupagam. Then we did yoga. We use Anulom Vilom meditation. We tell people how to do the Anulom Vilom meditation. We teach them. We use Anulom Vilom pranayam, Nadi Shodhan pranayam, Pavana Muktasan, Uttana Padasan, small exercises, Shavasana. And we also help them in techniques of self-suggestions to overcome grudges, which we think is one of the major reasons for heart disease. Or rather, there had been studies which had been published saying that keeping the grudges in your mind make you more of a cardiac patient than anything else. So we try to help them to overcome the grudges through positive suggestions. And then we have diet and lifestyle. We have given a constant lifestyle and diet for the patients. We had used Tarpanadi diet from Ayurveda, and we had asked them to avoid curd, buttermilk, fermented foods, sprouts, fish, rajma, dal, and all food known to cause indigestion and constipation to the particular patient. This is written to them. We allowed them buttermilk once in a while, only especially in summer. Then we asked them to drink boiled water with jeera, and asked them to add padola, garlic, ginger, black pepper as ingredients. Milk can be used, and Arjuna bark. Many patients in North India believe that Arjuna bark has a great ability to help them to be cured of cardiac diseases. So whenever a patient asks whether we can use Arjuna bark, we allowed them to use that. Avoid sleep during daytime and keeping awake at night. They had to avoid keeping awake at night and not to hold back any natural urges. This is what we had done to them. Now, this is the demography of the patient. If you look at it, we had a large number of cardiomyopathy patients. Cardiomyopathy, if you understand, is a very difficult disease to treat. Usually, the best kind of a cardiomyopathy, there is no cardiomyopathy which anybody can have which is best. But of course, the best kind which you can have is a postpartum cardiomyopathy at the end of which you live for about 12 to 15 years. That is the maximum period, if you draw in a graph that you get. And then you have heart failure, ischemic heart disease, progressive pulmonary hypertension, and atrial septal deviation with severe pulmonary artery hypertension. These are not very common diseases which you see in a cardiac OPD, but we have the largest cardiology program running in the hospital in the country. So we see a large kind of these patients. Since you have a large number of cardiomyopathic patients, we had looked at what were the kind of cardiomyopathic patients we were looking at. The maximum number of cardiomyopathic patients were dilated cardiomyopathy, followed by postpartum idiopathic hypertrophic and hypertrophic post PTCA, which is a stenting, and then another one was simple hypertrophic. This is what you should look. This is the most important slide. The kind of improvement in ejection fraction. You can see this is huge. This is in our cardiology department, which is one of the best in the country. This is huge. So I don't know for anybody else, but we know that this is an excellent opportunity for us. The red columns are basically the after the 6 months, and the blue ones are the before when the patient came to us first. And this is what we saw. Everyone got some kind of an improvement, but some of them got better improvement. For example, dilated cardiomyopathy had a definite improvement of more than 20%. That is for sure. So we have a very good interventional option in dilated cardiomyopathy, which is a very difficult disease to treat for any cardiologist, because usually the patients slip away from your hand in about 5 to 7 years or maybe about 10 years time. So if you can increase the permeability of the heart valves and heart vessels, and then improve the blood supply to the heart, then probably the patients might live longer. Then there are a few other areas where I think we have been effective. But basically, if you look at it, ischemic heart disease and heart failure, both are kinds of situations where the blood is not flowing properly into the heart and the heart muscles are dying. So in both these areas, we were able to